Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? I'm super excited today to have a very special guest, Dr. Brandyn Dunn out of Newport Beach, California. And we're going to be talking about some really interesting things here with facial rejuvenation and facial recovery. Hello, Dr. Dunn. Thank you for being on the show.
Hello. Thank you so much for having me. I'm excited to be here.
Me too. You know what? I am ready to get into it. I know a lot of my girls have been sending questions about facelifts. Is it time? Should I do it? What's the difference between this and that? And usually I talk about body and body surgery, but what I have found is once they work on the body, they're ready to get the face.
Exactly. Very true.
So they're like, my body now looks like I'm in my 30s, but my face still looks like I'm 55. So how am I going to make that work?
Let's go.
Let's do it. So for someone who's considering surgery, how do they know it's time for a facelift?
That's a great question. And a facelift is typically, I'll just kind of lay the frameworks a little bit. So a facelift and a neck lift, I typically perform together. So that's the lower third of the face, kind of from the high cheekbones down to the neck where there's laxity in the neck. And so I will typically say that, the age and range of facelifts are typically between your 40s and 60s, but that's a range and everyone is different. So definitely it depends on your anatomy and it depends on the aging changes that you see in your face and whether a surgical procedure or a non-surgical procedure is a better option for you to kind of give you the improvements or refreshments that you are looking for. It's not, a simple kind of quick, easy procedure. It's a much more involved, much more kind of extensive buy-in on your part to be able to get the results that you're kind of looking for.
Absolutely. So one of the questions I get very often is, how can I do a facelift or a surgical lift without having that ugly scar? This is what they say, that ugly scar across my, in front of my eye, in front of my ear or down my neck. And I've been hearing a lot more often of endoscopic surgeries and people trading the scar for endoscopic. So why don't you tell us a little bit about the differences between those and who is a better candidate for which, or how do you decipher when to go with which procedure?
Yeah, that's a good question. And I agree. I think endoscopic facelifts are becoming much more popular. Personally, I don't offer them. And so I would say that, I can speak on behalf of them and kind of give some information about it. But, there are a few surgeons within our industry that are complete experts in that. And that's kind of what they have focused their entire career on, is becoming endoscopic facelift surgeons. And so, if you really are thinking about that, I would highly recommend, someone going to someone that just does endoscopic facelift surgery, because it is a very, very technically different procedure because, you're working from far away using cameras and different types of tools and instruments to be able to try to do the same types of things under direct visualization. And I get it. You want to try to get back to normal as quick as possible. And you don't want people to necessarily know that you've had something done. And I understand that. And I think it makes sense. I think the important thing to understand is that the facelift incisions are placed in particular areas so that they are in transition zones between one area of the face and the other of the face, whether it's the cheeks and the hairline or in front of the ear and actually along the curvatures of the ear or behind the ear or in a natural crease underneath the chin. they're placed in these areas so that they're not as visible. And so, yes, some amount of scarring is inevitable. But I will also say that the technique of the facelift that's being done has become so much more advanced that when we do a deep plane facelift, which is the extended deep plane facelift, which is the procedure that I do, um, the tension of the incisions are not on the actual incisions themselves. When they are placed on the incisions, that's when you have scarring that leads to poor outcomes. Thickened scars, raised scars, widening of scars, hypotrophic scars, all of these different things that people do not want, nor do I want. And so when you put the tension on another component of the lift, you don't get those. You actually get really, really well healed incisions and scars. So I think it really does come down to it. What I would encourage patients to do, and what I always say is like, if you've decided in your mind that I do not want a scar in front of my ear, which is fine, some people have preferences. Don't go to a surgeon who doesn't do an endoscopic facelift and try to convince them to do an endoscopic facelift. That's the wrong approach to do. Let your surgeon do the procedure that they feel the most comfortable with doing so that they can give you the best result. So, don't try to push or tweak or try to kind of influence the procedures. You pick a surgeon based on their results. You pick a surgeon based on your comfort level with them, your trust in their office and their staff. And, if you feel comfortable and confident with them. And so that's how I kind of typically answer those types of questions.
I love it. I love it. I always tell my girls, when you're picking your surgeon, once you decide this is it, the next step is trust. You just
Definitely.
trust
Definitely.
that they're going to make the right choices for you, that they're going to help you through the process and give you the results that you're looking for. But that's the tricky part. For a lot of my girls, the tricky part is the releasing control and just trusting
I
that it
get it.
will be
I get
happen.
it. I get it. Yeah, you become very vulnerable. It's a very vulnerable situation. And I think body surgery is different than face surgery. And so, the thing with body surgery is, you can put your clothes on and you don't really see all of these things. Your face, you can't hide. And so the trust is even a bigger factor. And I agree with you completely. And, there will be points in your recovery. I know we're going to get into this, but there's going to be points in your recovery after surgery that you're going to question things. And you're going to say, is this right? Is what it's supposed to look? Are you sure this is going to actually work itself out? Are you certain about this? And you may look to other things. You may look to other things, other options, and that's normal to do. I try to make sure that I take on a very hands-on post-op experience because I know that those things come up. So yeah, I agree with you. Trust is a really big factor. It's extremely vulnerable, and you got to find the right person.
Absolutely. So, for my listeners who don't know this, one of the reasons why I decided to bring you on, Dr. Dunn, was because of your approach of boutique style practice. That to me is something that is very attractive for me when I'm looking for a patient with my girls. If I'm looking for a surgeon for them, I want to look for a surgeon that I know is going to be hands on and it's not going to be like they never get to see them again. So boutique style practice is like green flag for me because I know that means hand holding. I know that means they're going to be really on top of pain control, of swelling, of answering the questions that you might have already answered 10 times, but they still want to hear it again.
Definitely. Yeah. I mean, I honestly, it's how I would want to be taken care of. And that's why I do it. So, I think I think that that's really what it comes down to is that you want to take care of people the way that you would want to be taken care of or your family member would want to be taken care of. So, yeah.
Absolutely. So now the next thing that I wanted to get into, because once you decide that you're going to go through with surgery, right? You're like, I'm going to do it. You have to start planning for recovery. And a lot of information out there on the worldwide internet is conflicting. do this, do that, hot compress, cold compress, get massages, don't get massages, get this laser machine, do this, do this. So it can get very confusing for any patient when they're looking for body or for face. So what I wanted to go over with you is the day-to-day recovery process for a patient who just had a deep plane facelift, and what they can expect for that first month, what they can expect as they are recovering from that initial surgery. And let's start with the first 24 hours.
Yeah, perfect. I do this in every single consultation because I want to make sure that, and the other thing that I do in every single consultation is I take a lot of pictures. So I take pictures every single time that my patients come back to the office, even if they don't look their best, and they're looking at me like, why are you taking this picture? But it's important so that we can kind of track and follow and make sure everything is going in the right direction. Um, and the other thing that I always say is, this is a big investment. It's a investment of time. You're blocking out your schedule. All of us are very busy. We always have so many things going on. It's an emotional investment. It's a financial investment, and it's a physical investment. And all four of those things are critical to understand when you make that leap and that step. So, what I will say is that in the first 24 hours, it's a little bit of a roller coaster the whole way. And I think it's critical that I'm there to kind of help you throughout the process. But, healing takes time. And several things that I recommend and encourage in the first 24 hours, 72 hours, the first couple days, is that you have a support system with you throughout that process, because you are going to need to depend on someone else to do very simple things that you don't just feel like you want to do. You're either uncomfortable or you just don't feel like you're your best. And you want to be with someone that you feel like you don't have to act. You don't have to put on a show. So, I have some patients that go to facilities that take care of them. I have some patients that hire on nursing staff or MAs to kind of help them at home if they want to be at home. And then I have a lot of people that have family members or friends that help them through the process. So, I'll typically say that the big thing in the first 24 hours is we try to get through the night without any sort of nausea or vomiting. Nausea and vomiting can happen with longer procedures and anesthesia. And so, I always make sure that my patients have anti-nausea medications to kind of help them through that. I want to encourage them to eat and drink liquids and make sure they have stuff in their stomach when they're taking pain medication or any sort of antibiotic. And those are super helpful to kind of make those first 24 hours reasonable. I typically put on a compression dressing to kind of keep everything in place and make sure that there's pressure along the areas that's healing. And I take that off the following morning, and we check on everything to make sure everything looks good. First night, you're not going to get the best night of sleep that you've ever had. You're going to kind of toss and turn and pretty much be a little bit uncomfortable that first night. But every day after that, things are going to kind of get better and better. But yeah, I'm going to let you ask other questions and we can kind of jump into other details. I could go on forever about it.
Of course. You hit a really good point of having somebody that you don't have to put on a show for or pretend to be tough when you really don't feel like you're that tough. Because no matter if it's a facelift recovery or a body surgery recovery, that initial recovery period, you do feel very vulnerable. And especially for a lot of us that are moms and we're usually the ones taking care of everybody else around us, stopping and asking for help is almost impossible. It almost feels like too much so we do need to have somebody there who's almost a few steps ahead of you, knowing, okay, she's going to need some water. She's going to need to get up to go to the restroom. She's going to need to do all of these things. And so you don't have to ask for it. They already are a couple of steps ahead. So I do like to recommend for it to be a nurse or an MA or some type of recovery staff, so that they've already done this before multiple times, tons of times. So they already know what you're feeling, what you're thinking, what you are needing next before you even know you need it. So I do love that recommendation.
Yeah, and I'll say, like, even simple things are going to feel hard. Getting up, getting yourself a glass of water or cleaning your incisions, things that when you didn't have surgery are very, very easy to do, So I think just understanding that. And the other thing I always tell patients is to give yourself grace, let yourself recover. You don't, if you're trying to get to a certain date and try to heal really quickly or whatever it may be, you're going to disappoint yourself. And, we don't want to be disappointed. And yeah.
Yeah. Okay, so then let's talk about um what okay. We talked about it a little bit, but let's talk about the post-op blues that come with this, which already kind of ties into feeling vulnerable and all of that, that some women might experience during this recovery period. We call it the post-op blues because it's something that I found when I was a coordinator. Patients wouldn't really tell me that much about it. They would just mention it to me like, "Oh, I kind of feel bad." But once I launched my podcast and once I was offering my discovery calls, I was hearing it, things that they would never tell me when I was a coordinator, things that
Yeah.
they would never tell me when I was in the office. So post-op blues, I realized, was actually a lot more common than not common.
I agree. So I would say it typically comes in two periods of time, and everyone's different, and these are obviously like rough estimates. But I would say sometime within the first week, early on, when either anesthesia is finally slowly getting out of your system, or you're uncomfortable, you just can't get comfortable, you're just not feeling 100% like yourself. And people start to feel down, they start to question things, they start to feel not great. That is very common during the first week or so. And then the second time, it varies, everyone is a little bit different on this one, but it's anywhere from 2 weeks to 4 to 6 weeks. And that second time is when individuals are expecting in their mind to be fully healed, but they're not, and you get discouraged. And so that's kind of the second hurdle to get through. And so those two major hurdles, I think, it's critical for me to be there for them during those times, because, who else is there to turn to? They don't have the resources, or the people that they're talking to don't necessarily have the experience that I have to help them kind of get through the process. And, these are big surgeries. There's always something that will come up, whether it's really, really small or it's really, really big. Without a doubt, there's always little bumps in the road as you are recovering. And so, being present, going back to that boutique practice, having me and my staff be present throughout the entire process to kind of help you is critical, so that you can get through those. And, some patients don't have blues, but I would say most patients do. Most patients do at some point, whether they tell me or not.
One of those things that I feel in that second phase, that second hurdle, is the swelling. So let's talk a little bit about swelling and what they can expect and what they can do to help the swelling get better.
Definitely. So, in the first couple weeks, the most important things that you can do, first week or so, the most important things that you can do with swelling is what I have all my patients wear a compression wrap. And so wearing your compression wrap is extremely helpful. Keeping your head above your heart, and that's avoiding any sort of collection of fluid in the area. So when you're bending down, you're bending with your knees going straight down. You're sleeping with a couple extra pillows when you're in bed. You don't need to be sleeping straight up. But most of my patients are like, "I'm sleeping straight up." I was like, "Well, I want you to sleep. You can you can relax a little bit." Avoiding salty foods. Because salt can retain fluid, and that can definitely hold on to it. And then icing. So the first week I recommend icing because that helps to decrease swelling. The second weeks or several weeks after, swelling typically for that is not as much related to the surgical swelling, or like the post-surgical swelling, which is basically collection of fluid into an area that has been injured during surgery. It's related to lymphatic drainage, the inability to drain fluid that normally gets drained by our body. So anytime that you have a procedure that is done where the skin is violated and some of the undersurface is dissected upon or violated as well, then that can disrupt the lymphatic channels, which are basically the little ducts and channels within our body that help to drain extra fluid that we all naturally produce. And when you've had injuries, you tend to produce a little bit more. And so it takes 3 to 6 months for those channels to fully reform. So there are changes between day one, immediately after surgery, to 3 to 6 months. During that entire process, as these channels are reforming, you are going to sometimes deal with swelling a little bit worse than other days. Sometimes you had a salty meal. Sometimes you had an extra glass of wine. Sometimes you didn't sleep very well. Whatever it may be, that can cause you to swell a little bit more than you previously have swelled up before. So massage, lymphatic massage, warm compress after the first week. I typically recommend warm compress, which helps to increase blood flow to the area, and then that helps to mobilize the fluid. All of those things are very helpful to kind of help with post-op swelling after the first week.
So you touched on something that we love to talk about on the show, which is lymphatic drainage massage after surgery. How soon do you usually let your patients be touched by somebody to do some sort of facial massage?
It's a very good question. I think it depends on the person that they're going to. So, not all patients are from the same neighborhood and can always go to the same lymphatic. So my comfort level for them is different. So, I will say if I don't know the person that's doing the lymphatic massage, I at least wait after 1 week. If I feel very comfortable, then I can have them do it a little bit sooner. But in the early stages, that's when problems or concerns can arise. And so you want to make sure that it's very gentle in the beginning, especially with the face. The biggest things that we worry about are seromas, hematomas, and psylomas. And all of these things are basically different types of fluid that can form underneath the skin. And if you are manipulating it too aggressively during the early stages, then some of those things can potentially happen. So yeah, I think it's a fantastic tool to help you. But it's a little bit of a trust factor of when I let them start.
Yeah, I totally agree. I think that's probably an answer I get across the board from different, even my body surgeons. They're like, I don't know how hard they're touching them. How hard is the pressure? So they always like to play it safe. And I agree. Let's play it safe and not do anything too early so that we can avoid messing anything that we are not supposed to be messing up. Let's not touch it.
Yeah, exactly.
Let's talk about scar treatment.
Okay.
So, after, let's say they're past their initial recovery period, and now they're like, okay, what am I going to do for these scars? What do you usually recommend?
So scars they're going to heal. They honestly, they all heal. They all heal so well. It just takes a little bit of time. So, time is the first thing. It takes time, but there's things that we can do to kind of help that process along for sure. So what I recommend, it depends on what stage we are in the healing process of what exactly I recommend. So once the stitches come out, so I take out most of the stitches, the visible stitches at around 7 days, 6 to 7 days. And then there's a couple other stitches that I take out around 10 to 14 days. So once those incisions are fairly well healed, which is typically around the 2-week to 3-week period, I will start my patients on scar gels and silicone scar gels and silicone sheeting. On the body, a lot easier to do silicone sheeting. On the face, not as easy. A little bit more, you got to do a little bit more arts and crafts when it comes to that. But yes, I typically have them do silicone gels in the morning and silicone sheeting at night. That helps with pigmentation and redness of the incision. It helps to maintain moisture in the wound, and it helps to decrease inflammation and helps the scars ultimately heal a little bit faster. The other thing is sunscreen is extremely important, avoiding the sun. The sun is literally the worst thing that can happen to your scars. And it's not like your body where you can cover up a lot of the scars. This is, these are visible areas that can be sun exposed very easily. So that's super helpful. Other things is if there's any sort of thickening, or, sometimes you can get a little bit of ropiness or thickening behind your ear. I sometimes will inject steroids. I have a CO2 laser that I can sometimes use to kind of soften out the scar, which basically creates small little channels into the scar, gets the scar tissue to remodel, and it gets that to flatten out. But I will say that, most incisions end up healing really, really well with just some time. And so I allow my patients to put makeup, powder, or foundation, or anything to kind of cover up the scars after about 2 to 3 weeks. And most people can't see it at that point.
I love it. What is your opinion on the different red light therapy treatments that are out there for scars? Do you think they're as effective as they're promoted to be?
Sounds like there's a right answer with this. No,
No, I'm just
no,
curious.
I know. No, definitely. I agree. So there's a lot of people that are trying to make money off of consumers. And yeah, it's not. It really comes down to the intensity of the light, the duration that you're using it, and how close it is to the actual treating area. So that's the big thing. And there are studies on lights that are medical grade red lights. And as frustrating as it is, the ones that you can buy on Amazon typically are not studied. Although there may be benefit, it's just, I think that the chances of harm is very low. So I think that me discouraging it is, other than financial, maybe if you are too close to the skin, maybe it can cause some irritation. But yeah, I'd say for the most part, the downsides is not really there as much. It just is probably not going to help. And so I would say medical grade red light therapy is probably the best. If you can, I have it in my office every post-op. They can come in and sit under it. It's for 20 minutes, 20 minutes or so. And they can come in as much as they want during the first 2 weeks.
Nice. So I knew there was the studies for medical grade red light. I've seen some crazy things in the Facebook groups where I'm like, you guys know that's probably not working. It's probably not being very beneficial. So I know there's a lot of, like anything, gimmicky things online of what can work and what can't work. And I'm always going to trust what's in the office versus what's on Amazon.
Yeah, definitely. I agree.
Another reason why I wanted to bring you on was because I really like that you wanted to talk about recommendations for an up and coming facial plastic surgeon and how a competitive busy market, how to compete in a busy market like facial plastic surgery. And the reason why that, to me, I like that is because I really love uplifting other people. And I love helping other people reach their potential. And I like working with people and connecting with people who also enjoy that. So that was something that I thought was really cool to hear from you of how can you help other up and coming plastic surgeons.
Yeah. Well, I appreciate you bringing that up. I think first thing I'll say is there's enough to go around for everyone. Everyone jives and vibes with different people. And, I think that we're all different in our own ways. And some people will love my approach, love my results, and some people are not. And I hope that I feel very fortunate and blessed to continue to get the people that love and vibe with my office and just kind of feel accepted and supported in my office. So I feel like that's one thing that I've definitely learned. The second thing is as I've kind of continued to go on, and I'm obviously early in my career, but I as long as you are doing good work, you're honest, and you work hard, you know, things will continue to grow and things will continue to build. And I think that word of mouth and all of these referrals are so incredible. And I feel so fortunate of the people that, tell their friends and family. It's so helpful. And it means that's like the biggest compliment that I can get. And it's pretty cool when they keep coming in and you're like, wow, that's awesome. So I think like that's one of the things that I will say is, if you focus on kind of your competition, of course, know what other people are doing in your area and doing throughout so that you can, stay on your toes. But I think that just focusing on those things is really not going to help you throughout that process. So I'm excited. I mean, obviously I'm early in my career. If someone wants someone who's, 20, 30 years out, then clearly I'm not the right office for them. But, so I put everything forward and people know who I am. And so I feel very lucky that I've gotten very, very fortunate with a lot of awesome patients.
I love to hear that. So now we know that you have a big referral base patient population, which to me is a huge green flag. And so if my girls want to come see you, how can they find you?
Yeah. Best place I would say is probably Instagram. I've got a good presence on Instagram. It's at Dr. Brandyn Dunn, BrandynDunn. And then my office is called Coastline Plastic Surgery. So I'm located in Newport Beach, California, which is in Orange County, which is just south of Los Angeles. And we've got a small, beautiful office that has a nice ocean view. It's a great place. And you can give us a call. I've got a website, and I'm sure I'll be able to provide a bunch more information for you.
Wonderful. So if you guys love this episode, make sure you share it and write a review. And if you want to go see Dr. Dunn, go see him and remind him you heard him on the Big Butts No Lies podcast.
Yeah, definitely. Thank you so much.
Thank you for being on the show, Dr. Dunn, and we'll see y'all next week.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey. And don't forget, new episodes every Monday. I'll see you then.